News tonight, the opioid crisis continuing to rattle the nation, and concerns are growing with the use of an FDA-approved veterinary tranquilizer. Our Caleb Yager is here tonight in studio to talk about, Caleb, another concern to add to the opioid crisis, and it's pretty alarming. What did you find out today about this potentially lethal substance?
Yeah, good evening, Eva. Xylazine is meant to be used on animals as a tranquilizer, but now we are seeing the substance being used in opioids like fentanyl. Kensington, Philadelphia is known as one of the largest drug spots on the East Coast, which is where this is commonly found. But health experts are saying that this is going to be going in a very bad direction soon across the country.
This is a major public health emergency.
As the opioid crisis continues to cause extreme concerns, the sedative Xylazine is making its way into opioids, which is an FDA-approved veterinary tranquilizer. In other words, this is not meant for humans.
The veterinarians use it for surgical procedures on large like farm animals. When you combine that with an opioid, you get, it is extremely powerful.
The typical solution to treating an opioid overdose is naloxone, but the problem is that it cannot treat Xylazine.
It would only reverse the effects of fentanyl or heroin or an opioid.
The effects of Xylazine can be so severe to the skin that it can require amputation.
These aren't just, scrapes and cuts. They are wounds to the bone.
It's also becoming more and more frequently used.
They might not have initially been looking for it, but now since it's really permeated the illicit drug market, you can barely do without. You can barely buy drugs without it being in it.
Users are also going into withdrawal much quicker than other drugs, which can be as little as 2 to 3 hours.
Once it started getting into their system, it made their withdrawals that much more difficult, and so made them want it more.
And Dr. Moore also told me that Gaudenzia services over 14,000 people each year combined from all of their locations. 30% have overlapping substance abuse, but here in Erie, they serviced over 1,200 individuals in the 2022 fiscal year, and most of those cases have been related to opioid use. Live from the studio, Caleb Yager, Erie News Now.
All right, Caleb.